in your head. But reason number 2 is your brain is not cooperating. Guys, I tell all my patients that the first time you have a problem with erections, it's also in your head because you're going to think about it. You're going to remember, oh, I had an issue. And the next time you try to have sex, you're going to think about it. But your brain is the most important sexual organ you have. Not your penis, your brain. The moment you start thinking about, oh my God, am I going to lose my erection? Am I doing this right? Why isn't she orgasming? Or whatever the case may be, that distraction activates your sympathetic nervous system, which is the opposite of your rest and digest. It's your fight and flight response. This constricts blood vessels and makes blood leave the penis. Really important to make sure that your brain is in the right place. Now, performance anxiety can be a vicious cycle because you are stressed about performance for whatever reason. And then because of the stress, you either can't get an erection or can't maintain it. Then you get more anxious. And then again, you can't have an erection. It just cycles worse and worse and worse until you're completely in your head. But this is something that we can deal with. You have to talk to your partner, consider seeing a sex therapist if you're really struggling. And I often tell patients, take sex off the table. Be intimate without penetration. That means touching yourself, touching your partner, maybe not even touching genitals right away. And then over time, as you start feeling more confident, you can start touching genitals. And then again, over time, eventually you can go back to penetration once you're not stressed about the ability to get an erection. Oftentimes medications can help here as well. I often give patients a 5 milligram dose of Tadalafil, which you take every single day. This is a really low dose medication, and it can help just sort of give you that little boost of confidence to get your erections back. And then once you feel confident again, you can stop the medication or continue taking it, whatever you prefer. Now,